Hello, and thank you for listening to my presentation. My name is Melissa Sheldrick, and I am the Patient and Family Advisor at the Institute for Safe Medication Practices Canada. ISMP Canada is a national, not-for-profit organization that is dedicated to reducing preventable harm from medications. We are a part of the Canadian Medication Incident Reporting and Prevention System, CMIRPS, which is a collaborative pan-Canadian program of Health Canada, the Canadian Institute for Health Information, ISMP Canada, Patients for Patient Safety Canada, and the newly amalgamated Canadian Patient Safety Institute and Canadian Foundation for Healthcare Improvement. The goal of CMIRPS is to reduce and prevent harmful medication incidents in Canada. We are committed to the advancement of medication safety in all healthcare settings, and to learn more, you can find us at these websites. Our main ismpcanada.ca site is primarily directed towards healthcare providers with resources tailored to those professionals. SafeMedicationUse.ca is our consumer website where you can find resources written specifically for consumer audiences. mederror.ca is our medication error reporting platform and is the reason I am giving this presentation here today. By the end of this presentation, participants will be able to explain how consumer medication error reports contribute to increasing patient safety and improving medication safety systems. Medication errors happen in all sectors of healthcare, for example, in hospitals, in pharmacies, in congregate care settings, and even at home. Many healthcare settings have a vehicle to report medication errors, but not all. It is for that reason that consumers, patients, or caregivers need an effective way to share what has happened to them. Have you ever picked up a prescription from the pharmacy, brought it home, and realized the wrong medication was in the bag? What would you do? At ISMP Canada, we wanted to raise the voice of consumers in medication error reporting. Since 2010, we have been collecting error reports from consumers through our website, SafeMedicationUse.ca, and the analysis that comes from every report leads to learning. Systems have been impacted as a result of some of these reports. I will share an example of this impact later in my presentation. In 2019, a group of dedicated patients, safety organizations, and other experts came together for 2 days to participate in a sprint workshop. This process aims to solve a complex problem in a short amount of time. The experts define the problem, ideate, develop prototypes, and then test them. Coming up with potential solutions after only 2 days by way of developing prototypes motivated members of the team to collaborate and push forward. At the end of our meeting, we determined that we needed a new, user-friendly, easy-to-engage platform for consumers to learn about medication errors and to give them a straightforward method to report. The prototype that was developed was detailed and gave a clear direction of how we wanted to build this platform and the content that we wanted to include. mederror.ca was born, a clean, easy-to-use platform to report any errors or near misses, available in English and in French. A medication error is a mistake that was made with a medication, such as a wrong dose or a prescription for a drug where there is a known allergy. What if you received the wrong dose of your prescription? We want to hear about it. Not sure if it's an error or a reaction to a medication? mederror.ca helps you to be able to tell the difference between the two, and you can use our platform to report a reaction which goes to Health Canada's pharmacovigilance program. We are committed to reading every report that is entered into the system, so even if it's entered as an error, but it's a reaction, we'll redirect it for you. Consumers are encouraged to leave their contact information on the reporting form, so that as we try to figure out what happened, we can ask clarifying questions to try and get the most complete picture possible. It also gives us an opportunity to share what we've learned with them and how we are going to close the loop. As I mentioned, every report that is entered into our system is read and analyzed by our consumer analysis team, a team of medication safety specialists and consumers. We aim to understand what went wrong and how the error happened, a systems-based approach. When we determine the important learning from each case, we decide how to best share that information. One such way is a consumer newsletter that focuses on a report and learning that came from the error. Sometimes we connect with manufacturers or regulators or other organizations to work with them to prevent recurrence. Our newsletters get published approximately 10 times per year, and you can sign up to receive them from our website, safemedicationuse.ca. The newsletter on this slide is from a report that we received about a child who almost ingested hand sanitizer as it was packaged in a container that looked similar to a water bottle. Fortunately, the child did not swallow the liquid, but she did feel burning in her mouth. These types of cases were increasing last year with the onset of the pandemic and the increase of hand sanitizers available, so we felt that it was very important to share what we had learned. As I mentioned before, great impact can come from just one report. This is an example of how one report can help prevent errors from occurring. A mom sent a report to mederror.ca that her child drank from a bottle that contained the child's antibiotics. There was no child-resistant closure, and the child was easily able to take off the cap and drink it. Thankfully, poison control was called immediately, and there was no serious harm done to the child. ISMP Canada reached out to the manufacturer, who confirmed that those bottles were not fitted with safety closures and that they would work with the supplier to ensure that the packaging includes a child-resistant closure. We also alerted Health Canada, who is following up with the companies. We recently heard from this mom expressing her gratitude to our team for our agility and comprehensive action to preventing future errors. She writes, "I'm very grateful to you and your team for taking this issue forward and addressing it in this manner. Thank you for following up with me today and as you progressed along the way. It was very reassuring to know that our concern had been acknowledged and managed throughout the entire process. The speed at which this took place would not have been possible if it were not for the collaboration between the mom, our organization, the manufacturer, and the supplier. To be able to work together helped facilitate the process and would not have been possible if it weren't for this report and the willingness to collaborate on the part of the parent." Now it's time to share mederror.ca. One of the other prototypes from the Sprint workshop was to develop an awareness and engagement campaign. We want all Canadians to share their medication errors with us so that we can work together to reduce preventable harm from medications. We have been sharing the site with our partner organizations, patient safety and engagement groups, and we are honored to be able to share it here at the BC Patient Safety and Quality Council Quality Forum 2021. Medication errors happen. Share the message, and please be sure to use the hashtag #MedError when posting on social media. Please tag us when you share. You can follow us on social media. We have ISMP Canada and Safe Medication Use accounts on both Twitter and Facebook, and ISMP Canada on LinkedIn. You can connect with us to be amongst the first to know when we highlight mederror reports that have been submitted and the learnings that we glean from them, as this information is often disseminated via our social channels. Thank you for taking the time to learn about the importance of medication error reporting, and I hope you will share what you have learned here today. Please feel free to send me a message with any questions. Thank you.